Reboot to robotic screws. Spine surgery, what was done and now is very much different. Evolution is inevitable. Only the fittest are going to survive. Pedicle screw placement is important because any of the malposition can cause severe neurovascular complications. Hence, to reduce the iatrogenic complications and improving the surgical outcomes, usage of robot is possibly a good option. OT workflow can be different in regards to the patient being either in prone or in lateral position. The robot can be the supervisory controlled or a telesurgical system. However, the one that we used in spine is a shared control system. It is shared between the surgeon and the robot. The brain, eyes, and hands are basically the surgeon himself. Robot is not an actual robot. It is basically a better version of us. The inputs are given by us, not by its own. Planning is by us. Execution is by the robot. How does it help? It helps in dexterity enhancement. So basically, it helps us to get a perfection at the microscopic scale, not just at the macroscopic scale. Greater accuracy, precision, and sustained repetitive motions is possible. Even getting corridor small access is very much possible. The tremors of the surgeon, which are normally 40 micrometers, can be reduced to 4 micrometers with a robotic interface. Studies have shown significantly good results with robotics tools. So when we talk about not being able to do that, so the failure is generally because of either the mechanical movement, device failure, surgeon aborted, device reachability, or no registration. However, in majority of the cases, it is fully executed. Multiple studies, randomized control trials, deformity cases, multi-centric studies have already shown significantly lesser X-ray exposure, complications, and reoperation. Studies have shown a better response in regards to the facet violations, S2AI screws, and also when there is a comparative analysis done between freehand and pedicle screws. The humans have the limitation of the normal dexterity. They are prone to tremors, and also they have limitation in sterility and also prone to error. So the robot helps here by giving a better, control, and repeated tasks can be done better. In regards to the maximizing the potential of MIS, robot is basically the additional thing that we can do. The next step in MIS, radiation exposure is the least with robot assisted surgeries. The learning curve is better once the 30 screws are placed, and also there is no significant difference that would be seen in lesser experienced group versus the expert surgeon group. Conventional surgeries have a increased opioid consumption, infection, CSF fistula, increased hospital stay, repositioning of screws, and intraoperative errors. So multiple studies have shown that all these do come down, and we have better outcomes with respect to the robot assisted surgeries. Tool skiving is one of the major limitations because of which the misplaced screws are there, which also with better planning can be negated. Lower hospital cost overall when we reduce the complication, that is one of the major advantages. Infections are lesser tenfold. Long-term results were studies, and overall when we talk about the misposition screws, repeat surgeries, repeat fusions, hospital stays, that was better in the robot assisted groups. 5.6 lower risk of surgical complications and 11 times lower risk of revision surgery, and overall radiation exposure is lesser. Now, this particular study showed a $600,000 saving in one academic year in regards to getting the technology in place, because we reduce the revision charges, infection rates, and the length of stay, and the OT time as well. Systematic reviews have already shown all this. Now, screw accuracy increases, robot time reduces over time, fluoroscopy time reduces, length of stay reduces, and abandonment also reduces. Now, when we talk about major thing, the ASD, so facetal violations are lesser with respect to the robot assisted placement. The cons with navigation are, with navigation we have to identify the bony landmarks. It might also sometimes be inadvertently might knock down the reference frame. That also goes away with the robot. Toggling movement might be there with a screwdriver, which might change the trajectory. It's also not there with the robot assisted surgery. Navigation versus robot. The robotic arm is equipped with 3 integrated optical cameras. It helps the robot to self-detect the location and reduce the intraoperative collision. MazerX system also helps to get the independent registration of the vertebrae in place. Navigation versus robot. So robot helps us in getting a better predefined, pre-programmed path. Accuracy is better. Repetitive motions are possible. So the paths, get us to a better path, and also, in some smaller accurate areas that we need, that is better. With the sensors, there is a significant improvement in regards to change of commands and also immediately stopping the movement. So the robot is better than navigation because it eliminates the hand of wrist fatigue, tremors are reduced, precise repetitive movements are possible with a robot assist technology. Now, this particular study showed that whatever we plan in the navigation might not come out in reality because of some movement that may happen. So hence what we plan and what we execute is two different things, which might not be possible once we use a robotic system because with robot we have the exact execution of the planning. The technical accuracy of the bony tip is 1.7 plus minus 1 millimeters of the entry point. What are the advantages of robot assisted system? Reduced radiation time, accurate insertion of screws, lesser complications, dexterity is better, revisions are lesser, infection is lesser, blood loss is lesser, reduced operator time, and there is a good accuracy, I would say, decreased violations of the facet joints and reduced hospital costs. So, navigation guided and freehand techniques can never compete with robot assisted surgeries. However, there are pitfalls because of which there might be some restrictions to the use. Equipment, software program are the logistics issues that one might face. Manage the unexpected intraoperative complications such as when you opt to insert the screws via the conventional techniques despite the availability of the robotic system. Skiving is one thing, so the planning should be better. Equipment or software failure malfunction could force the surgeon to abandon the robotic guidance, and hence one should be well versed with the conventional techniques also. Overall, it should be used wisely, and together we can do miracles. Thank you.